Very good morning, doctors. Welcome to our new session. So today we are speaking about a very important part, that is the medicine. What are the topics that you should revise? See, I am telling 2 points. Either you study the whole subject and you concentrate exclusively on these topics which I am about to note it down here, or you have second option, that is you at least prepare the so-called topics which I write here. At least, no need to go on again and again and again and again the whole medicine, but you at least revise the topics which I write down here. At least do that one. No need to go on with each and every topic. At least do that part. That is sufficient. No need to go all around the medicine. Don't rotate the hairs on this side and that side. Don't do all those circus. The only thing that you have to do is just revise the topics. I will give you just something like at least you say it like 10 20 no, not 20, so it will be some more, not 20, sorry. So it will be something like, wait, total number of how many topics, it's something like you will be having a total of nearly 40 topics. Okay, you have a total of 40 topics. So please prepare all these 40 plus topics, every topic. And what I want you to do is, I will tell you 3 points. You just follow this. I assure you, in the 100% of the medicine questions, you can attempt not less than 92% of the questions. For example, 30 questions were given from medicine. You can attempt easily 24 questions. That is my guarantee. I will not say like other people or other professors who take classes for you, like you can attempt all the 30 questions, you can attempt all the 100% questions. No, I don't give those type of blind guarantees, but I can say if you prepare all the topics which I noted down here, you can attempt easily 94% of the questions given from the medicine subject. If you ask me in the form of questions, MCQs, from total of 30, you can easily attempt 24 to 25. That is my guarantee. Obviously, you can easily manage to hold on to this. Okay, so without making any delay, we'll get into the real topic. So what are the topics that are very much important and guaranteed, damn sure topics that you will get in the Inicet this year? Okay, now starting with I just section the medicine into 4 quadrants, right? Into 4 quadrants. So according to that, I will just write down the topics. You just note it down. Okay, so the first quadrant consists of, so see, I have right here with different colors. First I'll start with the black. The first quadrant consists of rheumatology. Don't say that Sir blindly has given a whole chapter name. No, in rheumatology what you should prepare, now I will tell. First one is hemochromatosis. Second one is Wilson's disease. Third one is Behçet's disease. I think you know Behçet's disease. Behçet's disease is there. Behçet's syndrome is there, right? So Behçet's disease. Fourth one is gout. Very, very important. Gout is very important. I am expecting a damn sure question from gout. And fifth one is systemic sclerosis. This is not that much, but still you might get a question from it. Now sixth one is vasculitis. All types of vasculitis, not only one type, all types of vasculitis. And in that vasculitis, if you ask me classification, what is the classification given in vasculitis? The Chappell's classification, right? The Chappell's classification is very important in the vasculitis. And the most of the important thing, that is SLE. Okay, These all topics are very, very important. You just go through these topics. Very important. You ready now? Next, what are other topics? Coming to the endocrine. See, these all topics come under first quadrant. Okay, these all topics come under first quadrant. Why I have written like this means, for you also, you can just simply take like for example, you just divide these 4 quadrants. Like, I will just prepare 1 day for first quadrant, 1.5 day for second quadrant, and 1.5 day for third quadrant, and 1 day for fourth quadrant. So like that you can divide, okay, so that it becomes easy. Why? Because if you go on medicine directly, like I will start from chapter 1 and I will go to chapter 30, it will be a confusion. So you just divide in these quadrants. For then in the examination also, if you got a question from Wilson's disease, obviously your mind will strike like, I think you read from first quadrant, doctor, please revise once again, so that your mind can easily recognize. See, our mind is designed like that, so it needs a pre-planning. It needs a particular planning, right? These all are arranged here, these all are arranged here, these all are arranged here. So it's like an almara, it's like a almara, it's a desktop, it's like a almara, cupboard. So you arrange in each shelf. So in first quadrant we arrange rheumatology and endocrinology. Okay, rheumatology, you see, right, we just checked all these topics are very important, right? And in endocrinology you should study PFT, then comes DICO, then comes volume curves, then you should go for asbestosis, occupational diseases. Okay, and in that asbestosis, then HSP, very important, HSP, then pneumoconiosis. Guys, this will be a question either from medicine or at least from the pathology. You will get a one question, right? Pulmonary embolism, guys, this is the topic that you should read from Harrison's. That is for sure. At least you give a reading regarding pulmonary embolism from the Harrison. You have 3 to 4 tables. You just go on with it. Regarding pulmonary embolism, there are 2 to 3 tables in the Harrison. You just go through it. You will get a question from it. That's for sure. And in regarding pulmonary embolism, the radiological aspects are very important. I am pretty sure that you might get a question regarding the radiological aspects of pulmonary embolism. Now coming to one more topic, that is ARDS, acute respiratory distress syndrome. In ARDS, the most important thing is the criteria. As all the professors say, criteria of ARDS is very important. Then obviously regarding the emergency medicine point of view, you should go through the ventilation, its mechanisms, all the circuits, all those factors which define the prognosis of the patient, the complications, and mainly the ventilation basics that you should revise. No need to go into the depth, but basics are very, very, very important. And finally, I want to include this one, but sarcoidosis is one more thing that you should keep in your basket. So this is up to what? This is up to quadrant 1. Now we will get on to quadrant 2. Quadrant 2. Okay. In quadrant 2, what? Wait. See this one. It's I forgot. I just wrote it. I just made a small mistake. It's not a mistake even, right? Actually, I just ran out. So it's not endocrine. Actually, it is respiratory. Okay, it's a respiratory system. Respiratory. Okay. Sorry, so many doctors might get a confusion. It's actually respiratory. Sorry. So next, we'll just start with quadrant 2. In quadrant 2, we will write about the topics that you should read from CVS. Guys, CVS, as all the doctors speak, ECG, very, 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 very important. Okay. Then after that, you go for rheumatic heart disease. In that, you should know the criteria and the factors that affect for the mitral stenosis, mitral regurgitation, aortic stenosis, aortic regurgitation with all sounds and murmurs, what type of murmur is seen in what sort of condition, right? And mainly the management, what is the management for mitral regurgitation, what is the procedure protocol for mitral stenosis, everything should be perfectly discussed. Third one is pericardial diseases. Pericardial diseases. And one of the important one, I want to underline it, MI. MI, everything. I think you should go through complete Harrison related MI chapter only. You just go through the MI chapter present in the Harrison, everything. But in that, if you ask me which should be revised multiple times, that is management. Management of MI, very important. Then comes, we have endocarditis. Regarding endocarditis, if you ask me which one you should go particularly, it is infective form. Infective endocarditis is very important and it should be read in combination with management. Okay. Now there is a criteria in endocarditis. If you are okay with it, you should read this criteria. Very important. Duke's criteria. Okay. Now coming to the regular questions, you will get a clinical based scenario on shock, hypovolemic shock, hyponatremic shock, different types of shocks, and the main thing that you should read is the management. This one also you should go from the Harrison only, right? So these all things you should read from the Harrison. Now one more system that should be covered under Quadrant II is nephrology. In nephrology, what you should ultimately everyone know and everyone will study this acute kidney injury, complications and management. Very important. As well as you should also study the biomarkers and the criteria that is being analyzed in the AKI, acute kidney injury. Then obviously if there is acute, you should also read chronic kidney disease, its manifestations, stages, treatment. Stages are important in CKD, stages and management. Now one more thing in nephrology that is very important, obviously you will read in pediatrics also, it's glomerulonephritis. Glomerulonephritis, and the main important thing that you should read is histopathological point of view. Very important, most important. So in pathology, I am saying it once again, while you are revising pathology, please keep it in parallel way with medicine. Please, I request, I beg you, when you are reading pathology, nephrology chapter, please, while you are going through glomerulonephritis, please keep the medicine, you take it notes or resource, whatever it is, your medicine notes or anything, you just go parallel with pathology, you just read it integration. Don't read pathology separate, medicine separate. Why? Because you don't get question like that. You will get a pathology question with medicine integration, management, complication like that. Okay. Now final one is renal tubular acidosis, right? Different parameters, different criteria, different factors, right? Everything about renal tubular. This is one more thing that you should go from Harrison itself. Okay. So with that we complete Quadrant II, right? Now we will go for Quadrant III. Quadrant III. In Quadrant III, right, you should cover mainly endocrine first. In endocrine, what are the things? First one, pituitary mechanism, tumors and disorders, pituitary disorders. Pituitary disorders very important, but in that pituitary tumors are very important. You will get radiological question integrated, or at least you will get a metabological biochemistry related medicine integrated question. Okay, so pituitary tumors, adenoma, then you have Sheehan syndrome, very important. Then you have lymphocytic conditions, that is hypophysitis, all these sort of things. Then very important, galactorrhea. Please read the management. Drugs used in galactorrhea: cabergoline, bromocriptine every day, night time 2.5 mg, cabergoline 0.25 mg twice weekly. All these things please read regarding galactorrhea, right? Everything you should read, right? And one more thing is amenorrhea conditions, and mainly amenorrhea syndrome. And you will obviously read this, that is men syndromes, men 1, men 2, right? Everything you should read. And finally diabetes. My sincere suggestion, please go in Harrison. Please go in Harrison. And the images from Robinson, please check it. Okay, and you just read the management of diabetes and all the sorts of MODI, all the sort of drugs which are important regarding diabetes, that. And we'll complete with one more chapter, that is neurology. Okay, no, wait. I think we will keep neurology in the next part. Okay, so we will write here GIT. What are the topics in GIT? Obviously GIT, you start with something related malabsorption. Start with malabsorption, clinical scenarios, complications, and all sort of anemias that you see it, and metabological syndromes which are related with malabsorption, and biochemistry related conditions that lead to malabsorption. But simply speaking, complications and how do you approach a patient with malabsorption, that is important. Obviously go from Harrison. Okay, now obviously GIT means you will study inflammatory bowel disease, that's no doubt in it. But while going through IBD, please refer with pathology. You see the histopathological examinations of IBD, that is consists of which all things? Crohn's disease and ulcerative colitis. Please go on with the pathological histopathology of these both things, and as well as the clinical scenarios, the clinical complaints. So obviously you should go with Harrison. Please refer this topic in Harrison. Inflammatory bowel disease, go in Harrison. That is my sincere suggestion. Now there are some GI extra-intestinal manifestations. That one you should read. Extra-intestinal manifestations. All extra-intestinal manifestations. Right? So up to that we finished Quadrant 3. Now we will look on to Quadrant 4. Final quadrant. Finally, after this video I will tell you some important points. Please don't forget those things. Those are very important key points to secure that final MCQ that troubles you, trickles you in the exam. So I will give you 3 important tips. You just follow that. I guarantee you, you will get a rank below 1000. I can guarantee you. But if you get some more effort, I can assure you, and I can make you to assure yourself, you will get a rank less than 400, right? So let us finish the Quadrant 4 also. Okay, the final quadrant where we include neurology. Guys, don't feel tense. I will just do neurology separately, one session. I will cover anatomy, clinical scenarios, everything in neurology. No problem with that. Okay. Now regarding neurology, the first thing that you have to go through is multiple sclerosis. Very important. Multiple sclerosis. This is important for INICET as well as for NEET. Then you go for myasthenia gravis. Myasthenia gravis, pharmacology as well as medicine, very important. Then you go for all localization related disorders and pathologies. Localization related pathology or disorders. Please go through it. All of them, right? But if you ask me most important of it, you go from the most important ones. Okay. Then you go with the stroke. I think read stroke at least outer reading from Harrison. All sort of complications, all sort of EEG patterns observed in stroke, and main important thing is how do you manage a stroke, the drug therapy as well as the protocols and procedures. These two things that you should read for sure. Then obviously neurology means you will study epilepsy, no doubt in that. You study in pediatric, you study in pharmacology, you study in medicine, so no problem. You will get a stock standard stature on epilepsy treatment. Everything you should read. Epilepsy, there is no exception. You should read everything: cause, physiology, pathology, complication, drug therapy, procedures. Okay. Then coming to one more thing, that is dementia and disorders related to movement disorders. Please read these conditions, right? Means see, all you read is management. Okay. Then one more topic is ADEM. This one you should finish it off, right? Then LE syndrome, that is Lambert-Eaton syndrome. Lambert-Eaton syndrome, very important. Please read this. Then sometimes you will be asking something regarding AL sclerosis, that is amyotrophic lateral sclerosis. But most of the times you might get in a NEET PG exam. So, but still, INSET, I am expecting an image-based question from amyotrophic lateral sclerosis, so get ready. Then you will be asked with GBS, Guillain-Barré syndrome, as well as the T myelitis, Guillain-Barré syndrome, and some of the channelopathies. You know what is meant by channelopathies? We will discuss for sure. Channelopathies. You don't need to go into deep depth topics of it, just basics of channelopathies, that will be sufficient. Everything that are related to neurological considerations that you should read. Now with this, what other things you should include in Quadrant IV? The main important thing that you should read is fluid electrolyte balance. Now what are the topics that you should read in fluid electrolyte balance? Everything. If you have some notes regarding formulas, please revise these formulas, or also you can call it as numerics and numbers. Very important. See, for example, partial pressures, partial containers, or your saturation pressures. What is the minimum saturation? What is the maximum saturation that you should be maintained? What is the volumetric flows? Everything regarding formulas and numerics that you should just go on with. Okay. Then you already know metabolic alkalosis, metabolic acidosis. Obviously you will read it, no need to tell. Obviously you will read all those things. Respiratory acidosis, respiratory alkalosis. These four topics are universal topics. Obviously every aspirant will read this, so no need to talk about it. If you ask me electrolyte abnormalities, hypercalcemia, you read, you stress it. And one more thing is hyperkalemia. You just read these things multiple times. Hyperkalemia, you read the ECG's findings in it. You read the complications that are associated with it. You read the cardiac manifestations that you see in hyperkalemia, as well as you read the treatment and management protocols that you see in hyperkalemia. Very important. EEG, please try to solve hyperkalemia EEGs. Now with all these things, sir, are there any other things that we should? One final thing that you should read about is COVID and updates. Why? Because recently we got a news like the vaccine that was given for COVID is giving some serious side effects, and sometimes it's even leading to fatal conditions or death of the individuals who took that vaccine shot. So COVID is again becoming a trend. It is again becoming the topic of discussion. So I need you to study the COVID and its updates and all other medicine updates. Just before something like, for example, if the exam is in July, you just go through the updates up to something like April. That will be sufficient, or even at least March is sufficient. Don't go up to like for example, if the exam is on July 16th, what is the update on July 15th night 12 o'clock? What update was given? Don't go like that. You are not a ghost. Okay, don't go to all those rubbish. You at least just read up to the updates up to March. That will be sufficient. Don't go up to the day before yesterday what updates were given. Don't do all those rubbish. It just mug up your mind and it leads to some serious catastrophe in the exam. Okay, so don't keep all these catastrophe tensions. Leave it up. And as I have given you the word, the 5 important tips, tricks that serious. yes, that is what I spoke. And see, serious is ECG you should read. Yes, in ECG you should read atrial flutter, fibrillation, PSVT, SVT. These 4 topics: complaints, symptoms and complications. Mainly symptoms. ECGs of these 4 should be practiced like hell. You should be pinpoint perfect regarding the ECGs of these 4 conditions. And the main important thing is the management. What is the drug therapy you give? What are the procedures that are done for these conditions? What sort of surgeries are there for these conditions? What are the complications? What are the management protocols? Everything is important regarding this. Flutter, fibrillation, tachycardia, everything. Okay, so you should revise all these things. And one more thing regarding ECG is MI related ECGs. Previously I already discussed, that is STEMI, ST segment elevated MI, and non-ST segment elevated MI. These 2 things, pictures, images, diagrams, explanations, everything, just go on with Harrison. That is my one sincere suggestion. Okay, now I think I almost came to the end of the class, so I'll just give you that final 3 tips to study how to approach the medicine. Just spare with me for the next few minutes. Okay, just I will give you some few tips. Okay, so the first one is the topics which I have given. Please read all the tables related to the topics from Harrison. And one more thing that is important is just do it as fast as you can. Don't delay up to final month. Okay, you just take something like, for example, 6 topics per day. That would be sufficient. 6 topics per day and at least 4 tables per 3 days. You just read it. And one more thing is, you mark those tables. Don't just read and leave it. You mark those tables, and in the tables, if there are any extra points, you pin some stick papers. Write the points, management, drugs, anything. You just put some stick papers. That is point number 1, right? And point number 2 is, please try to go on with clinical scenarios that are given in Harrison. See, you have some yellow color tables, yellow color blocks in Harrison. You please go through those conditions. Yellow color blocks in Harrison. Those are the stock questions that you will get in examination. And one more tip that most of the students don't follow. Why, I don't know. Guys, please, you read the clinical scenario in Harrison, the clinical features which was given in Harrison, of the main conditions which I previously discussed. All the clinical features, please you read those, please I say. And one more thing is, ECG, just read the samples in the Harrison itself, or you can at least Google it from the Google also, you can read ECG, right? And one more thing is neurology. Please don't go on with Harrison. I don't support Harrison for neurology. But if you ask me for neurology, you can go with the Nimhan's textbook. That would be sufficient for neurology. Regarding every point of neurology, you go with Nimhan's book. You just take one topic. You have every topic related neurology. For example, you take neurology, multiple sclerosis, or something related to dementia, or Lambert-Eaton syndrome, multiple sclerosis, GBS. Everything was given in Nimhan's in the form of MCQs. So please follow that one. And one final tip for today. The tip of the day is, medicine is a vast subject. So the minimum target that you should keep in the exam is 94% of the questions. 6% leave it off, or else, for example, 30 questions was given, at least make sure that you make 21 of them correct. That's enough. That will keep you in the top 1000. No need to go for 30 for 30. No one can, no one may, no one even do that. You attempt for 24, make sure like 21 are correct, rest leave off the three things. If you make 21 questions, or at least 22 questions correct, that will be more than enough to push your rank and to bring it to one of the good positions. Okay, so signing off. Tomorrow we'll come with a new topic. We'll come with a class. So we will discuss something regarding the surgery. We'll finish it as fast as we can. So I'll make sure that I will go on with the schedule as per discussed. So with that, we'll drop the session. Thank you. Signing off. Good night.